name is Catherine Herrera, and today we'll be discussing how chronic obstructive pulmonary disease affects the innate immune system. In this presentation, we will determine what COPD is and how the innate immune system works under normal circumstances versus when COPD is present. COPD, otherwise known as chronic obstructive pulmonary disease, is a disease that encompasses many other diagnoses, including chronic bronchitis and emphysema. The diseases under COPD all affect the respiratory tract and are characterized by the inflammation of airways and enlargement of air sacs. COPD has a multitude of symptoms, including chronic coughing, shortness of breath, chest discomfort, and fatigue. COPD is caused by genetics, pollution of biomass fuels, and other life factors like smoking. Now, I will be discussing the differences between normal and COPD innate immune system responses, starting with how macrophages react, by drawing it out for you. Normally, macrophages in the innate immune system would bind bacteria using their pattern recognition receptor, otherwise known as PRR, to recognize the bacteria's pathogen-associated molecular patterns, otherwise known as PAMPs, and would become activated, phagocytizing bacteria and releasing inflammatory cytokines to warn other macrophages and call over neutrophils. And for further clarification, cytokines are extracellular signaling proteins that serve to call other cells of the immune system to help defeat the bacteria. This right here is the process summed up in another picture that makes it easier to see. Now, under conditions where someone has COPD, macrophages are defective and are not able to determine if the bacteria have entered the body, thus reducing the phagocytosis in people with COPD. Due to this, bacteria undergo chronic colonization and eventually become threatening enough to activate the defective macrophages on a wider scale, and when they become activated, they all release too many inflammatory cytokines, causing persistent inflammation. This inflammation is what causes airways to close and makes it hard to breathe for patients who have COPD. This image right here sums up what I do on the whiteboard and roughly shows the overall process that macrophages undergo when a patient has COPD. It is important to note that the specific cytokines that are released and affect a patient with COPD are IL-6, IL-1 beta, tumor necrosis factor alpha, and IL-8, which have been measured to further increase during exacerbations where patients' airways are closing. Macrophages in people with COPD, when activated, also tend to summon many more cells, like neutrophils, monocytes, and CD8+, which are very present in the airways of patients with COPD. Monocytes can then create more macrophages, thus causing an increase in the number of macrophages in patients with COPD. Due to the enzymes and growth produced by the overflow of these cells within the innate immune system, it could cause a variety of problems that are classified under chronic obstructive pulmonary disease, such as epiphysia and chronic bronchitis. Now that we've discussed macrophages, we're going to be discussing neutrophils and how they react. In healthy neutrophils, after they become activated, they can stay and kill bacteria along with macrophages, or they can transport a piece of the bacteria to activate B and T cells. In the case of normal neutrophils, they would travel with directionality towards the cells of the adaptive immune system to recruit help. As seen in this image and what I will draw for you, when a person has COPD, they have faster neutrophils than the average person. This would be a good thing, however, while their neutrophils are faster, they have less directionality. These neutrophils will end up not reaching the adaptive immune system as efficiently as when in normal conditions, prolonging the fight in the innate immune system. Not only will these defective neutrophils cause a slower adaptive immune system response, but they can also lead to damaged tissues in people with COPD. In conclusion, chronic obstructive pulmonary disease affects the innate immune system, and more specifically, macrophages, which in turn end up causing defects in all other cells and processes. Macrophage defects are a major part of COPD and a defining characteristic of the disease. Neutrophils are not as affected, but their defects also do lead to major consequences within the body. I hope that everyone has learned a little bit about chronic obstructive pulmonary disease with my presentation. Thank you very much for listening.